Sorry, just getting up, wrapping up some last minute things.
All right, I'm admitting a few more people. All right,
All
I'm
right.
gonna go quiet.
And can you see my? Sorry, just getting
Yes.
up, wrapping up some last minute things.
Close that tab.
Yeah. There we go. All right. Okay. All right. Hello, everyone. Hopefully you can hear me. All right. So my name is Rick Olderman. If you have neck pain and headaches, you are in the right place. So we're going to go through this webinar, and at the end, we're going to have some Q&A. And also at the end, I'm going to show you how to get a free DVD. So stick around. We're going to cover lots of information. I'm going to go rapidly because I know a lot of you probably have questions. So thank you so much for being here, and let's get started. So there's three things we're going to be learning about today. The primary problem behind almost all chronic neck pain and headaches. The second secret is what most practitioners are missing when they're trying to solve neck pain and headaches. In other words, why you still have it. And then the third secret is I'm going to show you a really simple test to determine if the information you're listening to tonight is the cause of your neck pain and headaches. So I think you'll get a lot of value out of this, and you'll know pretty much immediately. Okay, so here we go. A little about me. I'm a physical therapist since 1996. I'm also a hand semantics practitioner. I'm a Pilates instructor, personal trainer. I'm certified in therapeutic dry needling. I've been a sports and orthopedic clinic owner for about 10 years now. I've written 6 books. All of them are available on Amazon. And I, talk at conferences often. And this is a conference I was invited to. It wasn't even supposed to be about pain. It was about safety. But my seminar ended up being the most popular. I talked about neck pain in one of them and back pain in the other. And those two were standing room only, not because I'm a great speaker, but just because neck pain and headaches and back pain are so common in our society. A lot of people are looking for answers. So I'm glad you're here joining me tonight. And I think you'll really find some new information here that's refreshing and useful, actually. Okay, so let's get down to it. How do I specifically solve neck pain and headaches? So this gets into the first problem about, what is the primary problem behind neck pain and headaches? So there's one pattern of dysfunction that's happening that's causing just about all of this. And I discovered this working with a person who was involved in a motor vehicle accident. And for years later, she ended up having chronic migraine headaches. And I was working with her and neck pain too. And I was working with her and all of her pain was going away. It was feeling great. And on our last appointment, I thought, you know what? Let me just try and reproduce that accident a little bit. And I just pushed on her shoulder about 3 or 5 pounds of pressure. And she called me the next day to say that she'd had the worst migraine headache that she's had in years. And for days, I was just dumbfounded. I was just like obsessing about it. Like, why did that happen? And then it struck me that it was because the problem isn't her neck. The problem is her shoulder. And then after I discovered this, I found Dr. Shirley Sarman, who's a PhD PT lecturer out of University of Washington in St. Louis. And she's been a PT for decades and has written a couple of textbooks and written volumes of published research. And she has also identified this long before I did. I just didn't know about it. And she calls this a depressed scapula. And I'm going to explain what that is. But I'm saying this because what I'm talking to you about tonight isn't just something that I've made up out of my own personal experience. There's tons of research showing this. The problem is most practitioners aren't looking at the research. All right. And I have more to say about that if you have more questions. But anyway, let's keep moving. All right. So I'm going to lessen my picture here because I want to point out something. Here's a skeleton. All right. If you look at the architecture of the shoulder blade, and here it is a little bit bigger on this picture, you can see it's a broad, flat bone. The only other place in the body with a broad, flat bone is the pelvis, which is the center of function in our lower body and low back. So the scapula is also very similar to the pelvis in terms of its not only architecture, but function. It is a foundational aspect of how our upper extremity functions. All right. And there are rules about how these scapula should be functioning. One of them is that this spine of the scapula should be at thoracic level 2. I'm not going to go into all of the other rules, but just know that this is heavily researched and shown in that, these rules actually exist. So let's go down. So here's a picture of someone with depressed scapula, and I've marked on her spine here. This is thoracic level 2, which is where the spine of the scapula should be. But her spine of her scapula are way down here. That's about T4, okay? This is very common, all right? And so I have this picture because I want to show you kind of why this is critical to understand. So the scapula, look at this massive muscle that's attaching from the shoulder blade into all of the vertebrae of our spine and the base of the skull. It's called the trapezius. The trapezius is massive and it has various functions. I kind of describe it as the hand muscle. It has multiple functions like our hand does. Deep to this trapezius muscle, you'll see that there's this levator scapula, all right? It inserts from the corner of the shoulder blade up into C1 through 4. So and this is the way it works almost everywhere in the body. If the big muscle that's supposed to be doing its job isn't working, and the trapezius is one of them, the serratus anterior is another. If they're not functioning correctly, then the smaller muscles deep to those big muscles end up carrying the load. All right. In the case of neck pain and headaches, it's the levator scapula. So most people with neck pain or headaches say, oh man, I just have this pain right here. It's right here in my neck. Well, you're pointing to, and everyone that says it's your trap, it's your trap. It's got all these trigger points. No, it's not the trapezius. It's the levator scapula that's deep to the trapezius. All right. And so you can imagine, let's say this arm, if you were to weigh all the weight of the shoulder blade, all the arm muscles, the bones and the hand and all that kind of stuff, the arm weighs about 15 pounds. Okay. If the main muscles that are supposed to be operating this system aren't working well, that weight is transferred to the smaller muscles deep to it, namely the levator scapula. So you can imagine that if all of that weight, or at least a lot of it, was transferred to the levator scapula, it's going to cause compression, side bending, rotation, all sorts of problems in the cervical spine, disc bulges, arthritic changes, foraminal stenosis, all sorts of things like this. All of these are responses to excessive tension in those bones. Okay. So that's the importance of understanding and grasping this idea that, oh, maybe the shoulder blades are part of the problem. And I'll tell you, most of you on this webinar right now, your practitioners probably have never even talked to you about your shoulder blades as the source of the pain. The thinking that you'll hear from most medical professionals is that all the nerves that feed our upper body come out of the neck. Therefore, the neck is the center of everything in the upper body system. It is not. All right. It's the system of the shoulder girdle that is stressing the neck that then can compromise the nerves exiting the spine and head back down the shoulder. So it's this loop of issues. All right. For some reason, no one ever seems to look at the shoulder blades. And I'll show you how. You'll know. I'll give you the test at the end to show you, and you'll know whether your shoulder blades are the cause of your pain by the time we get done with this webinar. Anyway, that's kind of the anatomy I wanted to kind of introduce you to that you've probably been missing. All right. So one other thing that can be contributing to this, if you saw up here, the shoulder blade rests on the rib cage. Well, it's possible that the rib cage isn't in the correct position either. This is very common, and it's called a side bending problem. A side bending problem occurs when one side of the pelvis is higher and one side of the rib cage is lower. And this is usually the result of some dysfunction in that same side of the leg. All right. So if you can imagine, though, that if the rib cage is being pulled down by these strong waist muscles, well, then the whole shoulder blade is being pulled down by that rib cage too, and those waist muscles. So this is another thing that can feed a depressed scapula scenario. I have a patient right now. She came in last week, left-sided neck pain. She came in for left-sided neck pain. And through the course of our history, oh, by the way, I have, left hip pain and left knee pain. It seems like everything's happening on my left side. Well, and she's just like, go figure. Well, instantly, I'm already visualizing this. And that's exactly what our exam showed. And she's already significantly better because we know how to fix these things pretty easily. They're simply fixed. You just have to know what the problem is. Once you know that, you can fix it. All right. So anyway, she's pretty happy right now. But this is, if any of you are having all left-sided symptoms kind of thing, even in your legs, this is probably what's happening in your body. Okay. So I think so I'm going to go back to the big screen again. So I wanted to talk about a case study recently. Barb was an ER nurse with chronic migraines for probably 10 to 15 years. We got those gone in about 3 visits. However, I used a taping technique to correct the shoulder blade system for her. And in 3 visits, all of her pain was gone. But whenever we removed the tape, her migraines would come back immediately. Well, this is a red flag for me. We couldn't get her body to operate correctly, to hold the shoulder girdle in the correct position. I told her to go get an MRI. Luckily, her doctor was a patient of mine too. So they were used to me asking for weird things. And so she got an MRI. She ended up having 2 full thickness rotator cuff tears. All right. Unbeknownst to herself. And in my history, I say, hey, do you have any old injuries to your upper body that I need to know about? And she said, no, absolutely not. I'm healthy as a horse. And after she came back with her MRI tears, I said, I thought you said you didn't have any injuries. She said, well, 15 years ago, I hurt my shoulders, but they felt better after that. And so this has been going on. So her migraines and neck pain were compensation occurring because of her rotator cuff tears. Even here, she didn't believe that I was right. So she went to her orthopedic surgeon, shoulder doctor, and said, do you think these rotator cuff tears have anything to do with my migraines or neck pain? Absolutely not. There's no research to support that. Then she went to a neurologist. Do you think that these rotator cuff tears have anything to do with my neck pain or headaches? Absolutely not. There's no research to support this. So, I'm just a lowly PT. However, we know that when I tape her shoulder blades up, her neck pain and headaches go away. So after about 3 months of equivocating, she finally had rotator cuff surgery. Instantly, migraines on that side were gone and neck pain. And then 3 months later, she had rotator cuff surgery on the other side. That side's migraines and headaches were gone. Okay. I don't say this to brag or anything, but I want you to know that the people who you're seeing who have been treating you don't understand these connections. And so when you try to go to them for answers, they're giving you the answers they have based on their own, what the research that they look at, but it's not all the research out there. Okay. I just don't know how to emphasize that more. You got to keep looking. And I guess that's why you're here in the first place. So the second person I want to talk about is Sharon. She had chronic migraines. We got rid of them on their left side in probably 2 or 3 visits, but the right side never went away. She had an MRI for her shoulder, clear. Her doctor said, go to a pain doc. I didn't believe that there was nothing wrong with her shoulder. I got another doctor to do exploratory surgery on her shoulder. And ended up, she had 2 of the largest labral tears that he had ever seen in his practice in her shoulder that didn't show up on the MRI. I believe it was because the injury was so chronic that scarring had occurred and probably blurred the image in some way to hide what was actually going on there. But the really important thing was after she had the labral repair, no more neck pain and migraines. And I don't want to say this to say that everyone who has neck pain and migraines has rotator cuff tears or labral tears. That's not what I'm saying. What I'm saying is that there is undiagnosed stuff that likely may be happening in your upper body system that you're unaware of. that are contributing to your chronic migraines and headaches. Because frankly, most people who get to the point where you are right now, where you're listening to a webinar like this, have been to a lot of practitioners who have been working on your neck forever. And I'm no better at working on necks than anyone else, but I'm very good at working on shoulders. And the shoulders is what solves the neck pain. Okay. All right. So if you've been struggling, this is probably why. So this leads into our second secret, what most practitioners are missing when trying to solve neck pain and headaches. All right. So I call this component thinking, because in medicine, we're trained to try to find the structure that is the problem and fix that structure. You may have been told that the curve of your neck is wrong, or that you've got arthritis in your cervical spine, or stenosis, or disc bulges, or arthroscopy, or you name it. Look at all the structures here in this picture on the right. I mean, there's tons of structures in the neck to blame things on. And that's why I think it's overwhelming for a lot of practitioners to try and solve it. And that's why you can go to so many different practitioners and they'll all have a different take on what the problem is, because there's gobs and gobs of structures in there that can possibly go wrong. And so they just find one and focus on that, right? But it's component thinking. It's a component of a problem, but it's not the problem itself. This is how I see the neck, and this is how, and the rest of the body. And this, I call this systems thinking. If you understand how everything in the body feeds into areas of the body, you can fix things rapidly and more successfully. Okay. All right. Systems thinking. So the benefits of system solutions is that, like the stories you've heard, and I've got tons and tons more. All right. But like the stories you've heard, you get rapid results and you can fix everything because you're seeing the whole picture of what's wrong. And the nice thing that our patients like is that they are in control. We see what's wrong. We show the patient how to correct it. They can correct it. And when their neck pain or headaches go away, they're just like, oh, I did that. That was me who did that. I don't need someone else to do something to me to fix my pain, which is great. Okay. And then because they can fix it, then it doesn't recur as often because you know how to fix it. So you're going to fix whatever habits or whatever is going on there, and therefore it won't come back again. And if it does, you'll know exactly what to do. So we rarely have people come back for the same problem after we've solved a problem here. All right. Can anyone do this? All right. So you saw at the beginning, I wrote these books. Neck pain and headaches book is one of them. And I'm not, doing this to brag, but I want to show you something here. All right. So let's go back to this one. So I'm not going to read the whole thing, but these people have been through tons of people, but no more migraines, neck spasms, and countless doctor's appointments just after doing the exercises in the book. All right. The next one, the concept of my shoulders being responsible for neck pain simply never occurred to me and was never mentioned as a possibility by any of the practitioners this person had been to ever. All right. But this next one is the one that really cracks me up. It works because it has no neck exercises. I just thought that was so funny. So it says you won't find any neck exercises here, not one. But my horrible neck pain is almost gone doing these exercises. All right. And what I thought was really funny is near that review, someone else had given me a 0 or 1 star that said, this book doesn't have any neck exercises. So they gave me a bad review because I didn't have any neck exercises. Anyway, so I say this because these people read my book. They tried all the exercises in the book. They found that they helped them. They did it themselves. And that's the whole reason why I call everything fixing you, because it's you fixing you. It's not me fixing you. If you know what to do, you can fix it. And I've made it even easier than my books, because through the years, like I published that neck pain book back in 2009. So through the years, people have requested Skypes and Zoom sessions. And, I've understood now what they're missing from the book. And also, now that I've owned this clinic for 10 years, I've seen the patterns of issues that people are walking in with that are contributing to all of their neck pains and headaches. And so I've put all that information together into a downloadable program, and there's also a DVD that can come with it. So it's the Heal Your Headaches program. So really, will this work for you? Well, do you have chronic neck pain or headaches? If you do, it probably will work for you, because what that's telling you is, because the body has an amazing ability to heal if given the right situation. What it's telling us is that you have not been given the right situation yet. All right. So if you have chronic neck pain or headaches, then your problem is probably somewhere that someone hasn't been looking. And I can almost guarantee that everyone on this call, your practitioners have not been looking at fixing your shoulder girdle system. Either they don't understand the connections or they don't know how to solve it. All right. Otherwise, do you have upper trap pain? Does working at your computer increase your pain? Do you have a history of shoulder problems? Do you have a history of dance, gymnastics, yoga, or Pilates? Ask me a question about that at the end if you're curious about why I say that. Do you have unilateral neck pain or headaches? Are your neck pain and headaches the result of an accident? Is your pain exacerbated by shoulder work? If you do shoulder exercises or something like that, does that irritate your neck and head? Well, now it seems obvious, right? Oh, it must be my shoulder. Okay. So here comes the simple test. All right. We're going to determine. All right. I call this the armpit test. I came up with it myself. If you have someone, a really good friend, because they're going to be putting their hands in your armpit. So what you're going to do is you're going to stand there, and they're going to stand behind you. And first of all, what I want you to do is you're going to move your head and neck around. You're going to look up and down, and you're going to note at, like, for instance, what angle your head needs to turn in order to start feeling pain, how much that pain is, all that kind of stuff. So you're going to get a good sense of how tight and painful it is to move your head. Then that person is going to stand behind you, and they're going to put their hands in your armpits and lift up your shoulders. And they're going to lift up the shoulders, maybe a half inch, maybe an inch, but they're going to stand there and kind of jiggle those shoulders a little bit to make sure that you relax, because this is the key to the test. You've got to relax your shoulders into their hands. So if it's a weak person and you don't think that they're strong enough to hold up your shoulders, get a stronger person to do this for you. Okay. So you're going to do this test and you're going to hold it there. You're going to jiggle the shoulders around, make sure that they're relaxed. And then you're going to move your head around again and see if your neck pain decreases, your range of motion increases, and whether that generally feels good to you. Now, here's the interesting things. A lot of people say, oh yeah, wow, that's a big difference. But a lot of people also say, no, I don't feel any difference. But then when I put the shoulders back down and they get the weight of their shoulders back on their neck again, they're just like, oh my gosh, yeah, now I feel what that did. So sometimes people don't realize it until after the test is done and we put the shoulders back on their neck, that they realize, oh, that did make a big difference. So that's the test. It's the armpit test. In 30 seconds or a minute, you'll be able to know whether this shoulder girdle system is a likely cause of your neck pain and headaches. Now, one caveat to this is what I have noticed is that there are certain people who are really tense, right? And it's hard for them to let go. If you're one of those people, it's likely that you're not going to get a positive result on that test because you're so tense. You can't let go of all of your neck strain and the holding pattern that you've developed around that neck pain. So in that case, I'm sorry, you're just going to have to trust me. But I also have an alternative thing that you can try if you're one of those people. So if you sit down and watch TV at the end of the night, you see this person on the right with the pillows stuffed underneath her armpit. If you sit like this, you shove a pillow underneath your armpit, that's lifting the shoulder maybe a half inch or an inch, and you rest your hand on top of that pillow like that. That's almost the same as me doing the armpit test for you. So you can do that to both of your arms at the end of the night, sit down, watch some TV, and see if, over maybe 30 minutes, your neck feels a lot more relaxed as a result of doing that. If it does, it's another positive test. The shoulder girdle system is likely the cause of your pain. So I hope you guys do that and figure out whether the shoulder girdle system is the cause of your pain. To be honest, I can't remember the last patient that came in here with neck pain and headaches that it wasn't. And over all the 10 years, I literally can't think of one patient coming in with neck pain or headaches that it wasn't the shoulder girdle system. All right. So This method teaches you how to fix hidden pain causing habits, because if they weren't hidden, you would have fixed them already. The problem is your brain doesn't know that you're doing something wrong. And so in this series, I'll show you what's going wrong and why, and you'll fix those reasons why all this whole pattern is happening. Then on top of that, we're going to fix the tighter weak muscles associated with all of that. And then, and that therefore will then decrease strain to the tissues and joints, reducing pain. Okay, so how does this work? By fixing the neck. Start thinking of things in terms of a system. Instead of just my neck, think of it as the system that's affecting your neck, and you'll start to make fast progress. Okay, so if you go to fixheadacheswebinar.com, you can get my program for $47. Okay, there's 60-day money back guarantee. And you'll see a whole bunch of other programs on there. And if you end up getting the other programs, I give you a pretty good discount, because if you look at the body as a system, there's naturally going to be crossover between when you solve one thing, it's going to be solving other things. And so if people buy a bundle, I don't feel right charging them the same amount for all of the things, even though there's a lot of crossover. So you get a discount. All right. So the first 7, so I mentioned at the beginning how you can get a free DVD. The first 7 people who type in this code HNPW471, I'll see if I can see that. Yeah, 471 gets a free DVD and shipping and handling. You just go, oops, that's wrong. Not fix back pain webinar. It's fix headaches webinar. All right. So I'm going to go there right now and kind of show you what that looks like. All right, so we're going to share a different screen. Oh, hey, Alan, I can't share my other screen. Can you?
No.
Okay. All righty. So is it this one? I think it is. Okay, can everyone see this?
Yeah, we can see it.
Yeah, okay, great.
Yes.
All right. So here's the page. When you click that, when you type in fixheadacheswebinar.com, you're going to come to this page, and you'll see, my program here. You'll get the digital, and this is for the digital and the DVD, and it's $57.50. But if you type in that code HNPW471, I think, and if we hit apply, then what it's going to do is it's going to take off the cost of the shipping and handling for the DVD. So basically free. It's even going to take an extra $1 off. So now it's 46 instead of 57. So, and there may be taxes. I'm not sure based on your state and things like that. So when you fill this out, there may be taxes associated with that. Okay. So that's that. I'm going to now open this up. I'm going to go back to the webinar. And let's go ahead and open this up to any questions. And I've got my friend Alan here helping me with this. So he's going to kind of run who gets to ask the questions. Go ahead, Alan.
You can unmute yourself if you have a question, or you can raise your hand. You can type it in the chat, whatever you choose. Rick, while we're waiting on that, you might want to show the back end, like when you log into the membership area, what that looks like.
Oh, yeah, that's a great idea. Okay. So you might be wondering what it looks like once you do buy a program. So let's go ahead and look at this. Okay. Okay, so when you purchase a program, you're going to come to this area and you'll see all the programs here, but you'll only have access to yours. And we're talking about headaches here. So here's what you're going to get. So you're going to watch this video first, and it's going to explain how to use the program. There's an introduction, which talks about, why you're having neck pain and headaches, similar to what this webinar was about. And then you're going to go into the pain reduction exercises. So I've broken things down into two phases. One is a pain reduction phase. The other is a restoration phase, which is more of a strengthening phase to get you back to life again. But first of all, we want to solve the pain before we get into a lot of strengthening. So the pain reduction set, if we click on it, you'll watch a video, but all of the videos can be downloaded onto your computer. You don't have to keep coming back to the website. If you want to download a certain section, you can feel free to do that. Okay. Now, what's the difference between the first set and the second set? Well, the first set has all of my instructions, and that gets a little tedious and makes things go a little long. So after you've learned the exercises, you can just go to the second set, which is, I think, about 15 or 20 minutes of exercises, and then just go through that twice instead of, going to the first set. And then you'll go much quicker through the whole program. And I recommend doing it once a day, but if you did it twice a day, you would get better even faster. So if you have the time, it's a half hour probably per time that you do all of this stuff. If you have 2 half-hour sections during your day, you'll get results even faster. So then we move on to the restoration and strength phase. So I tell people to move on to that one. Once you're about 75% better, then you move on to the restoration and strength. And that'll be strengthening exercises to get you back to, gardening or weight training or, whatever it is that you want to be doing. Now, key to this program is changing bad habits. And that's where this is. So you're going to see like ergonomic recommendations and things like that there, and that will help you understand how to fix the things that you're doing during the day that are probably contributing to all of this. In the extra help section, I have taping techniques, and these, I'm telling you, these are powerful taping techniques. They are miracle workers for the people in our clinic. And when you try these, you should get almost instantaneous relief from your pain. And then what we do is you can wear the tape while you're fixing everything, and then eventually you'll wean yourself from the tape. So it's a great bridge to get you where you need to go and get you out of pain faster while you're fixing everything else. I also have some practitioner recommendations in there too. So there's a few things in there that you can take to your current practitioner and say, hey, could you do this for me and see if this helps my neck pain or headaches? So there's a lot going on there. You can download the full video from the website. There are checklists to go through the exercises to keep you on track and keep you going, doing well. There's a neck pain Semantics part 1 and 2. These are 2 videos that I've created that combine Somatics with biomechanics. They're unique and all part of this program. Now, at the beginning of the program, I ask everyone, if you can, please, to fill out this PDI test. It stands for Pain Disability Index, because a lot of people forget where they started with their pain. And so if you fill this out before you do anything, that gives us a good idea of where you are. You can fill out another one every day or after every week or after you're done with the whole program. But what this will do for me is it'll tell me how well you're doing, and it'll also help me generate research so I can take these numbers to other organizations and say, look, this stuff works. If you start using it, you can help your patients with this information. So doing a PDI test at the beginning and end of the program would be very helpful to you and to me. And then lastly, here in this bonus section at the bottom, this is open to everyone. There are 8 Semantics audio lessons I've recorded. Each one is about a half hour long. So there's about 4 hours worth of lessons here. All right. Now, these are especially, they target different patterns in the body: back movements, front movements, waist, rotation, hip, neck, breathing, and walking. They're very unique. They're designed to reduce neuromuscular tension associated with movement dysfunction. They're very powerful, and especially for you people who are in a lot of pain and you're in so much pain, you're afraid to even get started. The Somatics lessons is where you would want to begin, because that's what's going to start to unravel your body so that you can begin all the other stuff. All right. So hopefully that makes sense. That's kind of it in a nutshell. Okay.
We've got Nancy with a question. She got her hand up.
Okay, Nancy.
Let me see if I can have her unmute. You have to unmute yourself, Nancy. We can't hear you yet. There you go.
You've answered a lot of my questions just in listening to you, which is
Okay.
fantastic. And I had bought all of your books and videos previously, and I didn't have the direction. So I love this, that you are showing us the way that we should go through the program, which is wonderful. But I had a personal issue where I had all of my, I had neck surgeries, all the way from 1 going down, ending with 5 through 7 being fused. Is that going to keep me from being able to benefit from the program the way you're explaining it?
I don't believe. Go ahead, Nancy. I'm sorry.
Yeah, and I also have scoliosis pretty severely too. And I just wondered, will it hamper me or just make it take me longer to benefit? Or I'm not quite sure, because I just don't know. And I live in Denver. Would you suggest that I try the program or come in and see you, or what?
You all done?
Yeah.
Okay.
Isn't that enough?
A lot of questions there. So let's
Yeah.
go over it all. Of course, you can come into the clinic and see, and I've trained all of my therapists in this approach too. This was one of the reasons why I bought the clinic, because I wanted to test this out in a broader population, as well as see if other practitioners can learn this. And they can learn it really quickly, and they see miracles just like I do. So there's really no difference between me and them. But let's go into your scoliosis and cervical fusion real quickly here. Scoliosis. So there's different types of scoliosis. You say you have a severe scoliosis, so I'm going to guess it's something that you were born with. Is that correct?
Yeah. And it
Okay.
just, when I hit 50, it got worse. And
Okay.
Yeah.
Oh, well, that's good. Okay. So that means that remember that picture I showed of a side bending problem?
Right. Yeah.
A lot of people call that scoliosis. That's referred to as scoliosis, even though it's not true scoliosis, because true scoliosis is an S curve in the body. But even just this is referred to on x-rays and MRIs as scoliosis, because it's a lateral bending of the spine. But anyway, let's just say that you have true scoliosis. All right. So what often happens with true scoliosis is that one of these ribs up here develops a little bit of a hump. And so the scapula gets trapped. All right. It's like a little speed bump that the shoulder blade needs to go over in order to function.
Yes.
Yes.
Okay. Yeah, exactly.
So one of two things typically happens. Either the person overly, tries to pull the shoulder blade on this side of the speed bump, and then they get all of this kind of tension pain in here, or their shoulder blade gets stuck on this side of the speed bump. And so then they get traction from this direction.
Yeah.
So one thing that gives me hope for you is that if your scoliosis got worse after you turned 50, it means that there are functional players into the degree of scoliosis. We correct scoliosis all the time here.
Wow.
And it's because as we get age, the pattern that you're in gets deeper and deeper and deeper, right? Well, if it's getting deeper and deeper and deeper, it means that your muscles are likely getting more and more taut that are pulling you into that scoliotic pattern. Does that make sense?
Does.
So anyway,
yes.
correcting part of that scoliosis can have a huge impact on the shoulder blade, because if that side of the rib cage is down, like in that picture, then that could be the cause of the neck stress from the shoulder blade. Does that make sense?
Yes. Yeah.
So I also want to throw out this. There's also something called the Schroth method. Have you ever heard of the Schroth method?
I have.
Okay. I think there's a practitioner up in Boulder. There might be one here in Denver. I am not one, but they specialize in scoliosis and correcting that. They do miracles for scoliosis. I don't know if they understand this connection to the neck from all of this, but anyway, if you want to come in, we can help you with the scoliosis to whatever degree we can, and the neck pain. And if it's not as much as you want to in terms of correcting the scoliosis, you can seek out a Schroth method practitioner to to fix the scoliosis. To answer your last part of your question, which was the first part, you had the cervical fusion, because so no, it shouldn't really affect anything, because if everything is fused and nothing can move, then you're left with the only thing that can move is this, right? That's the only thing now that can exert stress to your cervical spine and head. So it makes sense to correct it, right?
Right.
If that's the only thing that can affect it, then, and nothing else moves, then it's, what do you have to lose to try it? I believe that it probably has a large part to do, especially in connection with
to hear that.
scoliosis.
I'm so glad to hear that.
Yeah.
And thank you, everybody, for letting Rick answer my question, because it doesn't pertain to everybody. So I appreciate that.
There'll be more people than you realize, Nancy. So good questions.
Okay.
All right.
So can I just look you up and set up an appointment, or?
Sure. The clinic name is Body and Balance Physical Therapy.
Body and Balance Physical Therapy?
Yeah. Yeah.
Okay.
Just call up and, we'll get you in.
Okay.
We're a little booked out right now, but we'll get you in.
Okay. Thank you. And thank you for doing this for us. This is wonderful.
Oh, well, it's totally fun for me, Nancy. I love it. So thank you for being here.
Okay. Thank you.
Yeah.
All right, Rick, we have Raquel. She may unmute, may not, but I'll just read the question here. She says,
right.
I had the book and associated videos and it didn't help enough. What is different here?
Yeah. So what I didn't have in the book, so remember that book was written back in actually 2008, published in 2009. So what is different here mostly is going to be the taping techniques. The Semantics are also here. And those are the two things that I was missing from that book. I didn't have those dialed in as well as I do now, Raquel. And also, hey, Alan, is that code for people who buy the books? Where can they get that code for the discount for this program? Is that on the?
It works the same way. So if they go to the book and then they use the link in the book and then the code, it's going to do the same thing that you're doing in this webinar.
Yeah. Yeah. Okay. So you can get a code if you've bought the book. You can use the code. I think, Alan, you said that it's in the book. Is that right?
Right. If you go to the book and you go to the link in the book and use the code in the book, you'll get the same discount. Okay.
So you can get a discount on this program too, because I want to keep selling people the same thing over and over again. So to answer your question, Raquel, yes, the taping techniques, the practitioner recommendations, there's a really powerful technique in there that I have for practitioners for scapular mobilizations, because a lot of people's shoulder blades are stuck. And so this is a technique I use in the clinic to get them unstuck. And you can take that video to your practitioner, have them do that to you, and you can have them then tape your shoulder blade for you too. And I think you're going to see probably an almost immediate change in your pain if you can have those things happen to you. In addition to all of the somatics, which reduces tension and so forth. So I hope that answers your question.
Okay, next I have Olive. May or may not unmute, but I'll just read the question here. So do you know or can you recommend anyone on the East Coast, specifically New Jersey if possible, that uses your methods?
I cannot, Olive. And this brings up a great question. So I have created an online program to teach other practitioners these techniques. And not only physical therapists, but yoga, personal trainers, Pilates instructors, chiropractors, doctors, because all of these people at some point encounter people with this type of pain. And it would help them, their practice, if they all learned it. So we're about to release that really soon. A few weeks, I think we're going to be there. So unfortunately, no one on the East Coast that I know of, I've never trained anyone over there. The only people I've trained are the people who are in my clinic. So unfortunately, no help there, but soon, hopefully.
Hopefully, I'll definitely be sharing your site with my physical therapist.
Oh, okay.
You know what? I have a great idea. Go to heal.
Yeah, go for it, Alan.
Faster.com.
Sorry, did you repeat that?
Healpatientsfaster.com.
Thanks.
Yeah, Olive, and they'll go there and they can sign up for they'll be on the wait list and they'll be notified once that site is done.
Terrific. Thank you.
Should be really soon.
Okay.
I'll tell you, Olive, what would convince them to take it even more is if you went to them with this program stuff and they saw that it solved your pain, and then they're going to be like, oh, I think I need to learn this.
Yes, that would be really convincing.
All right. Thank you, Olive.
Thanks.
All right, next I have Sashin. She says, thank you for all the information. I was curious why yoga or dance affects neck pain.
Okay. Oh, I'm so glad that someone asked that. Okay. I mentioned dance, yoga, Pilates, and gymnastics. So here, if you've ever seen a ballet dance and you've seen them raise their arms, what you'll see is they are trying to maintain a long neck because it looks pretty. But in order to maintain a long neck, they depress their shoulder blades in order to do that. And so this is why so many of those people in those professions have lots of chronic neck pain and headaches, is because they've done the opposite of what their shoulder girdle system should be doing. I believe, so the dance came first. So I believe, because I don't believe that so you'll hear instructions that say things like, okay, bring your shoulder blades down and back into your opposite back pockets, things like that, or squeeze the shoulder blades together to open up your chest, things like that. That is the opposite of what the shoulder blades are supposed to be doing. So I believe dance came first because the aesthetics of a dancer's neck looks so pretty that then bled over into yoga and Pilates and gymnastics. And so those disciplines have adopted that strategy of creating this long neck, which is then now ruining their shoulders and neck and headaches. So thank you for asking that question. And I've seen so many people with that history who have an extra, so you can have depressed shoulders but those people are actively depressing their shoulders. So it's doubly harder to fix that problem because they have trained their brain, they've trained their brain to depress even with the slightest movement of their arm or turning their body, or everything begins with this, what they feel is correct posture pattern. All right. Okay. That's my soapbox. Next.
I think that's all the questions we have for now, unless someone else has another one that they want to ask.
Great.
I actually have a question. I'm not sure if I'll be able to articulate it well, but I often sleep on my side, and my shoulder, the side that I lie on, is often turned inwards, right? It's like kind of scrunched up. Is that bad?
Well, especially if your pain is coming from your shoulder girdle system, then that is a bad problem. I'm going to show you. Is this Olive again?
Yes.
Okay, Olive. I'm going to show you something. Hopefully I can make you see it. I'm going to turn my screen like this. Can you see that lying on its side?
Yeah.
Okay. So this is you lying on your side. And what's happening is the shoulder and the hip are the widest parts of the body. So if you can imagine like two telephone poles, these are the two telephone poles. And so the spine is dropping down in between. And so the shoulder is doing most of the weight bearing here, as well as the hip. So if I'll be right back. If you get a pillow, right? I mean, not like this, but maybe a real pillow, and you put it underneath your trunk like this, that's going to make your rib cage do the weight bearing. And now it's going to unload the hip and the shoulder. So if you have shoulder pathology that's contributing to your pain, now it's unloaded and it feels a huge relief off of the shoulder when you sleep. Does that make sense?
Wow. That is a really interesting. Thank you.
Yeah. And so what you'll probably also do is need to put a little extra pillow underneath the head, because then that's going to drop down a little bit lower, right?
Mm.
So you also want to lift the head up a little bit too.
Okay, I'll definitely be playing with pillows tonight.
Yeah, play around with that. See how that works for you. Good question. So anything else? Anyone else?
I don't see anyone at the moment.
Great. Okay, well,
Can you put the link in the chat for where we can order the,
I'm doing it right now.
thanks.
All right, Rick, I'm sorry. I just wanted to put that in there. You can go ahead.
No worries. No worries. Okay, everyone. If there's no other questions, then I think that's all. Alan will be sending out the replay for this webinar, so you'll receive that. Don't worry. And that might be coming out this weekend. I'm not sure, a couple days probably. So, but I think it's live on YouTube right now, so you can go to YouTube and watch it right there. Right, Alan?
Yes, you can. As a matter of fact, there's something else I wanted to mention. We do have our Facebook group that we just started. So if you are on Facebook and want to join our Facebook group, I'll pop the link in here in just a second and grab it for you. It is, of course, I'll put it over here.
While he's doing that, I just want to thank everyone. I want to, mostly what I want to do is give you hope that there is a solution to this. All right. The body's natural state is to be pain-free. And the fact that you're still having pain does not mean that you're broken. It just means that you haven't found the right key yet. All right. And in my experience, this has been the key for neck pain and headaches. If it's not 100% of the key, it's a huge part of it anyway. So I think you would do well to go down this road and explore this.
Hey, Rick, we still have another question. Rudy popped in at the last second here. It says,
All right.
Can inverted breathing cause a lot of tension in the neck? Let me see if I can unmute it.
Inverted breathing?
Can inverted breathing cause a lot of tension in the neck?
I don't know what inverted breathing is. But I'm guessing if you're asking the question, then yes, it probably is causing tension in the neck. Otherwise, you've probably been trying it and maybe you've noticed more tension in your neck. I'll tell you, and there's so many things floating around out there about changing function and breathing and so forth. And there's a lot of great breathing stuff out there. And I don't want to dismiss that, but if it's neck pain and headaches you're having, I can almost guarantee that the shoulder girdle system is a much bigger component of that problem than maybe your breathing technique. So maybe try, if that hasn't been working for you yet, maybe put it aside, pick it up later, fix the shoulder girdle system, see if that solves everything. If it doesn't, then you can go back to the inverted breathing, but I've never heard of that, so I can't really comment on my thoughts on what that is.
Okay, so I don't see anybody else typing anything just yet. So I think that'll pretty much do it.
Okay, folks. Well, again, thank you all for being here. Keep looking for answers. They're there. So, and feel free to email me.
Yes, I'll put your email in the chat too. So support@rickolderman.com.
Yep.
Thank you so much. This was very helpful.
I sure hope so. I sure hope so. If you follow it, Olive, I really believe it will be. I wouldn't be wasting my breath. It works for so many people, tons and tons of people.
Really encouraging.
Good.
All
right, folks. Well, if that's all.
Thank you so much.
Oh, my pleasure, Nancy. My pleasure. Thank you for your questions. They're great
Thank
questions.
you for what you do for just everybody. And this is wonderful.
Oh,
Wonderful.
I'm glad.
Yeah. Very grateful for you.
Oh, well, thank you. Thanks very much. Anyway, thank you for being here at my very first neck pain and headaches webinar. And hopefully there'll be more in the future. I've got other webinars. I think hip pain is going to be next, but that might be in a couple of weeks. Right, Alan? Is that right?
Yeah, next week we're doing PT Q&A day, and then we're doing hip pain after that.
Yeah, so we're doing these Q&A sessions too, and then hip pain webinars coming up after that. Stay tuned.
Wonderful. Wonderful,
right.
wonderful, wonderful.
All right, everyone. Well, thank you and have a great night.
Good night.
All right.
Good
Goodbye.
night.
All right.